One of the most common problems with the early onset Alzheimer's disease is differential diagnosis of frontotemporal lobar degeneration. It's a group of demanding disorders affecting frontal and temporal regions in the brain. It's characterized by personality change, disinhibition, apathy, and language problems. It may be also sometimes accompanied by eating as well as some sexual behavioral problems also. As I said, it's actually a group of disorders, and there are three very frequent forms. The behavioral frontotemporal dementia is the most frequent type, and it's actually the most important disease in differential diagnosis of early onset Alzheimer's disease. We had so far 14 patients with behavioral variant of frontotemporal dementia. They were all males. Mean age was 58.4 years old. And what we have seen from our experience with the frontotemporal dementia patients with MOXO, that as I mentioned, we had the change in the impulsivity for the early onset Alzheimer's, whereas we have the change in the timing in the MOXO with frontotemporal dementia, especially with the behavioral variant of frontotemporal dementia. So HD was a 60 years old male who presented with apathy and personality change, and there were very mild findings in the routine neuropsychological evaluation, but using the MOXO we detected some change, and so far we have this nice experience that I think the change in the timing is usually some kind of a signature for the frontotemporal dementia in this group of patients. Evaluation. Normal pressure hydrocephalus is a disorder, especially we see in the later ages. It's due to the enlargement of the ventricles in the brain, which causes the clinical trial of cognitive impairment, gait problems, and urinary continence, and is treated by what we call the ventriculoperitoneal shunt operation that you see here. The shunt system drains the excessive cerebrospinal fluid from the ventricles, as you can see also here in the CT image. The important thing about the NPH is that first there is the problem of the differential diagnosis, and also the problem with the monitoring of the efficacy of the treatment. Because among all the demanding disorders, NPH is one of the few diseases that cause dementia that could be cured and treated totally if we detect the right patients early in the course of the disease. So even you have some cognitive impairment, gait problems, and urinary incontinence, if you detect the patient in the early course of the disease, then we can really provide some kind of a cure to this group of patients. So this was a patient first, you see the first evaluation including the MOXO, and then he had the ventriculoperitoneal shunt operation, and here you see the first month follow-up, third and the 6th month follow-up. You can see the dramatic improvement both in the clinic as well as you can see the change and improvements in the MOXO scores. Of course, we see a quite high number of cognitive problems, usually due to neurodegenerative disorders. This was a 67-year-old female that complained of memory problems for over the last 1 or 2 years. Her neurological examination was completely normal, so was her brain imaging and routine neuropsychological evaluation. So actually, her profile fits what we call subjective cognitive impairment, but there's a mild problem with attention in the MOXO, and she was started on venlafaxine, and it was started up to 150 milligrams per day, and you can see the dramatic improvement in the MOXO scores in 6 months follow-up.